will start for the whole world. Now it's approximately 10,000 people infected and 41 countries. 86 dead in many countries. 2 cases reported that are imported from US in Thailand, but now already contained and no any virus spreading or trading.
Where are those Thailand? 2 places in Thailand?
In Bangkok. In Bangkok, but already finished because it's more than 10 years already. An imported case. In Phuket, we still make a surveillance, searching for, but I have no any case, any suspected case.
Just to confirm about there was also a German tourist who died. It was suspected.
Yeah, but it's the lab it's not.
It's not. And she did not come to Phuket either.
I don't think
in Bangkok. Go ahead, yeah?
No, not here.
Okay. What about the other provinces in Phang Nga and Krabi? Do you know about them?
We also make a very good network together from the disease control sector in East Public Health Office. We very good collaboration.
But no cases in those Andaman provinces?
No.
Okay. What about then the prevention and screening? We know about the thermal scanners at the airports. First of all, do you really think those are effective? That they are the best way of checking first when people arrive?
So there's 2 things. The first one is the best way or not, and the effectiveness. We do not use only the thermal scan, but from the suspected area. The people who come from the suspected area and have any kind of symptoms need to be informed. So this is the first thing. And then for the second screening is about the thermal screen. But at everybody, if they have, for example, take some kind of painkiller or the medication for lowering the fever, that we cannot detect. So it's not 100%, at least maybe 70-80%. But for another intervention is that give them the health beware card. Health beware card, yes. So if they have any kind of symptom, they can contact the health officers immediately, and can do something that they need to be doing. Yeah.
In Phuket, these scanners, though, they're at the airport, also at the deep sea port?
The deep sea port, because if they have any big ship, yes. But if for the ordinary 1 people, 2 people, this we have not enough. So, but for this individual ship, usually they take a week or something on the sea. So already is rule out the infection.
Right. Also at the land gateway, Tatachai, is there any scanner there?
You mean
for the road?
On the road?
Entry into Phuket?
No. Because of that now, it's not endemic in Thailand.
So you don't think it's necessary?
Because they also have the screening in every airport already. So for the outbound coming to Thailand, already screened, and it's impossible to screen on the road. Impossible.
Okay. But you are, just to be sure, these scanners, if someone has the Mexican or swine flu, you are sure that these scanners will show an initial temperature rise? Yes. So they do help then. Okay. What about anyone who is suspected? You keep a check on them, yeah? You have this card, and they have to report. Do they have to report to you? By law, they have to report, yeah?
We use we have a guideline. For example, for the suspected case, we will send them to the hospital for the quarantine.
Wachira Hospital?
We have both Wachira Hospital, there will be the major hospital, and then another hospital, for example, Bangkok Phuket Hospital, and then they will have a rapid test first. The rapid test will have a result within 1 hour. If it's type A flu, this means that maybe. So they will have a confirm. It's the second step.
Okay.
And also here we have a mobile lab that can make a report immediate in 12 hours. So it means that we just admit for 1 night and then the day after we will know the result.
Can you tell us how many people might have been, or have been suspected already in Phuket?
I cannot say that it's suspected, but the people who maybe inbound or traveling, we were looking seriously for that, but it's not suspected that they will come from this area and then we detect them from the airport. Not like that.
But how many people have you, say, stopped and given these cards to keep a check on them already so far?
We keep the card for everybody.
Oh.
Everybody.
Right.
And until now, we have no case that have the temperatures.
Are you worried about Japanese travellers in particular because of the sudden increase there recently?
Also worry about that. It's not only the Japanese, but things is spreading quite rapid. So many countries, not only the Japanese.
The Malaysian cases as well on the border, because there was a case in Malaysia.
Yes, but what we're looking for is if it's human to human in that country, we look very serious. But if only the reported case, imported case, it means that they have no any contact in the country. It's not very suspected.
In the event of a case, do you have enough medicine to treat? I know it can't be cured, that's right, but it can be treated, right?
I can say that because of this is H1N1, so the mortality rate is not so high. If we looking for the information, we have approximately 10,000 cases, 86 dead. It means that 0.8% will be the fatalities. This is the first thing, that the mortality rate is lower than the bird flu itself. We can guarantee that if you got this disease, we have the medication.
You have the medication enough in volume, right? Also.